Don't let myths about diabetes mislead you. It's time to set the record straight. With over 537 million people living with diabetes worldwide, misinformation can harm your health more than the condition itself. Are you believing things like diabetes only affects overweight people, or you can't eat sugar? In the next few minutes, I'm busting 6 common diabetes myths with facts to empower you. Let's clear the confusion and take control, starting now. As a diabetes expert, I've seen how myths mislead people, even in 2025, despite diabetes affecting millions. Let's bust these misconceptions with the first myth. Myth number 1. Diabetes only affects overweight people. Not true. While obesity increases risk, diabetes can strike anyone, regardless of body size. About 15% of type 2 diabetes cases occur in people with a healthy BMI, often due to genetics or insulin resistance unrelated to weight. For example, some individuals have a condition called metabolic syndrome, which raises risk even if they appear slim. I had a patient, a 40-year-old runner named Sarah, who was shocked to be diagnosed despite her slim build. It was her family history, with both parents having diabetes, that played a role. She started monitoring her blood sugar and adjusted her diet, staying healthy. Don't judge by appearance. Get tested if you have risk factors like family history, no matter your size. Myth number 2. You can't eat sugar if you have diabetes. Wrong. Sugar isn't completely off limits, but it must be managed carefully. Small amounts, like a teaspoon in your morning tea, are fine if they fit within your daily carb limit, typically 45 to 60 grams per meal for most people with diabetes. The key is balance, pairing sugar with fiber or protein to slow absorption. I worked with a patient, a 50-year-old chef named Mark, who feared sugar after his diagnosis. He learned to swap sugary desserts for berries, which are low glycemic, and kept his blood sugar stable while still enjoying sweetness. You can do this. Check with your doctor, and try a small portion of fruit to satisfy cravings without spiking your levels. Myth number 3. Diabetes always leads to blindness or amputation. This is a dangerous misconception. Complications like these are not inevitable and can be prevented with proper care. Regular checkups, like eye exams and foot inspections, along with tight blood sugar control, reduce risks significantly. A 2024 study in diabetes care showed that only 5% of well-managed patients face severe outcomes after 10 years. I had a patient, a 55-year-old teacher named Lisa, who was terrified of losing her sight after her diagnosis. She committed to annual eye exams and daily foot care, avoiding complications entirely. You can take control, schedule regular screenings, keep your A1C below 7%, and protect your body from diabetes-related issues. Myth number 4. Insulin means you've failed. Not at all. Insulin is a powerful tool, not a sign of failure. For type 1 diabetes, it's a lifeline, and for type 2, it can be crucial when diet and oral meds aren't enough. A 2025 survey found that 70% of patients feel more in control after starting insulin, not less. I guided a patient, a 48-year-old nurse named David, who resisted insulin for months, fearing judgment. Once he started, his A1C dropped from 9.0% to 6.5% in 3 months, and he felt empowered. Don't let stigma stop you. If your doctor recommends insulin, embrace it as a step toward better health with diabetes. Myth number 5. Diabetes is only a blood sugar issue. Incorrect. It's a whole body condition that affects your nerves, kidneys, heart, and more. High blood sugar triggers inflammation, damages blood vessels, and raises risks for heart disease. Diabetes doubles your chance of a heart attack. Managing cholesterol and blood pressure is just as crucial as watching glucose. I had a patient, a 60-year-old retiree named Emily, who thought diabetes only meant monitoring her sugar. After learning the broader impact, she focused on overall health, adding daily walks and cutting sodium, which protected her heart. You can address all aspects. Talk to your doctor about a holistic plan to manage diabetes comprehensively. Myth number 6. Once you have diabetes, it's permanent. Not necessarily. Type 2 diabetes can often be reversed in its early stages with significant lifestyle changes. A 2025 follow-up to the DIRECT trial showed that 50% of participants achieved remission, normal blood sugar without meds, after losing 15% of their body weight. This often involves low-calorie diets, exercise, or even fasting. I worked with a patient, a 52-year-old accountant named Paul, who was diagnosed with an A1C of 7.8%. He lost 20 pounds through a low-carb diet and regular walks, reversing his diabetes in a year. His A1C is now 5.9%. You can explore this possibility. Start with small changes like cutting 500 calories a day and consult your healthcare team to see if reversal is an option for you. These 6 myths about weight, sugar, complications, insulin, scope, and permanence are busted with facts and real stories. Sarah, Mark, Lisa, David, Emily, and Paul all overcame these misconceptions to thrive with diabetes. Imagine a life free from confusion, where you're informed, empowered, and in control of your health. Don't let these myths hold you back. Act today. Verify with your doctor, and take charge of your diabetes journey. I believe in you, and together we'll turn myth into mastery with every step you take.